Greetings and welcome to my channel. I am your presenter, Dr. Paul Karitzis. And today I am going to be giving you a very brief overview of the process pertaining to becoming a clinical psychologist here in the United States of America, and specifically in California, because it is the state I am licensed in, so I can speak about California. Here in the United States, it takes roughly 10 years to become a clinical psychologist from the time that you matriculate at college in your undergraduate degree to the time that you are licensed with your state of choice. It is an inordinate period of time. So many things can happen in 10 years. Many people are derailed during that time and can't complete their studies, or are impeded from completing their studies due to certain unprecedented life circumstances that will arise at any time. So let's just say 10 years plus or minus 2. So for me, my pilgrimage in this specific discipline and field began a very long time ago, back in 1998. So we're going to rewind the clock all the way back to 1998. In 1998, or in 97, at the end of 97 rather, I completed my year 12 studies, so my high school studies. And at the time, I was thinking that I wanted to be a journalist or a writer. And I was dissuaded by my parents from pursuing that dream because they believed that writing and journalism was inextricably linked and connected with abject poverty, and that if I had pursued it, it would have immediately meant an impecunious existence eating macaroni and cheese. In any case, so I finished year 12 and I attained a tertiary entrance rank that enabled me to get into my third preference, which was Bachelor of Behavioural Science at Trobe University in Melbourne, Australia. I matriculated at Trobe in 98. My major was psychology. My co-major was behavioral neuroscience, which at the time was called psychobiology. It was the only subject that I enjoyed, neuroscience. And I mooched my way through that degree with minimal effort. I considered myself minimalistic in progressing through that degree. I graduated a semester late because I failed one of my electives. I failed law and literature. So I didn't graduate until midway through 2001. I finished the degree. As is often the case with youngsters, I didn't really know what I was going to do with the rest of my life once I finished. At the time, becoming a clinical psychologist or anything within the discipline of psychology didn't really appeal to me. It left a bitter taste in my mouth. I was very decadent. I was experimental. I was young. I was pro-social. I wanted to explore the world and travel. So I embarked upon much travel in the subsequent years. I basically forgot about academia and formal study and started to accrue life experiences, visiting different countries in the world, especially in Europe. I went to Asia, I went to Egypt, in Africa, and also visited the United States of America. And then when I first came to California, I was struck by the profound beauty of California. Just a phenomenally phenomenal place with so many things to see, a place that entertains all the senses. And I thought to myself, well, if I ever moved from Melbourne anywhere around the world, it would be here in San Francisco. And it became somewhat of a self-fulfilling prophecy, because many years later, in 2014, I did move from Melbourne to San Francisco to pursue a graduate degree in clinical psychology, but we'll get to that soon. So I did a lot of traveling in my early 20s. During that time, I was also a prolific writer. I really enjoyed writing, especially writing poetry, writing fiction. It was the ultimate expression of the soul, I believed it to be. So in 2005, I believe, I re-enrolled at Trobe University with the intention of completing a graduate diploma in professional writing and speech. So grad dips don't exist here in the United States. It's equivalent to 1 year master's study. As I was progressing through the grad dip, I met my first mentor, Associate Professor David Tacey. He's no longer an associate professor, he's a professor now, but he's fairly renowned in Australia for his work in Jungian psychology. And he introduced me to Carl Jung, who was my intellectual idol. I became enamored of Jung. I was especially drawn to the Red Book because it was the humus from whence the ideas of psychological archetypes would spring forth, the concept of a collective unconscious. And what really captured me about Jung was that he envisioned or saw mythological tropes and narratives as proto-scientific permutations or expressions of psychological processes. And that just captured me. It captured my imagination, and I said to myself, I'm going to study Jung. So I purchased innumerable books on Carl Jung, different theorists and writers that had commented on his works, and began reading up on it. So it was my first contact with transpersonal psychology as well, right? So we know that there are 4 pillars of psychology. We have behaviorism and Freudian psychoanalysis, and they're the more reductive, right, and more orthodox pillars. And then we have the emergent counterculture to those reductive streams, which are the humanistic existential stream and the transpersonal stream. So I became very, very interested in Jung, and I knew that thinkers like Jung and Freud weren't taught in orthodox streams of clinical psychology and psychology in general. So, I mean, if you think about La Trobe, they named the Bachelor of Behavioral Science degree behavioral science, so you can't get that much more reductive than that. They have since switched that term, so they've switched behavioral for psychological so that it sounds more integrative. In any case, I stumbled upon a book at that time. No, actually, what ended up happening first was that I became very, very interested in esoteric studies. So in Jung's interpretation of alchemy and astrology, and I said to myself, well, I'm going to study Western esotericism. So I did a bit of internet research and I stumbled upon Exeter University. Exeter University offered a degree in Western esotericism, so Master of Arts in Western Esotericism. I applied, got in, completed the degree in 2 years. I was there from 2011, 2013. Fantastic degree where you get to study Western esotericism from a more academic perspective. Unfortunately, that degree is no longer running. So I'm not particularly sure how many universities in Europe still teach Western esotericism. But Europe has always been fairly progressive when it comes to teaching non-traditional and more progressive streams of knowledge acquisition. So I finished that degree and I told myself, okay, so what are you going to do, Paul? Are you going to go on and do a PhD and perhaps become an adjunct professor and maybe do research part-time? Or would you like to utilize, your pro-social tendencies, your interpersonal effectiveness, the camaraderie that you form with many people? I consider myself an inherently social being and I do well in social situations. So I thought to myself, okay, maybe I could become a clinician and utilize my repository of acquired knowledge to help others in need. And I said, okay, so where am I going to go to school? And I came across a book at the time by John Rowan, an English psychotherapist. And in it, he talks about this specific school called the Institute for Transpersonal Psychology, now called Sophia University, which was based in Palo Alto in California. And I thought to myself, perfect. I've been there before. That would be a great place to live. So I applied. I was interviewed early 2014 and I was accepted and I did the big thing. I moved from Australia, Melbourne, to America, to Redwood City, roughly 9 miles away from Palo Alto, in September of 2014 to pursue my dream of becoming a clinical psychologist. It wasn't much of a culture shock. There's innumerable similarities between Australia and America, so adapting was no big deal. That's where my graduate pilgrimage began. As I mentioned earlier, I wanted to attend a transpersonal school, which combined an integrated and holistic approach to psychotherapy, an amalgamated, more conventional, I suppose, models of psychotherapy, which fell under the auspices of the Western mind sciences, with Eastern philosophy and esoteric concepts. And, as many of you know, I do have an esoteric bent and love to study esotericism, and I'm very concerned with how the nomethetical scientific disciplines, the orthodox scientific disciplines, may reconcile with Western esoteric spirituality. So a lot of my writings tend to gravitate around that. In any case, so I matriculated at Sophia University in October of 2014. Sophia University goes via a quarter system, not a semester system. Here in the United States, some graduate schools will follow the quarter system, some will follow semester. In Australia, it's just semester. So this was a new system. For me, the requirements that you need to fulfill to graduate with the degree Doctor of Psychology in Clinical Psychology at Sophia University was 120 credits of coursework. The completion and defense of a dissertation, usually towards the end of the degree, 300 hours or 300 clinical hours done, completed during your practicum year, 500 clinical hours completed for your advanced practicum year, 1,500 supervised clinical hours for pre-doctoral internship, and 1,500 supervised clinical hours for postdoctoral. Oh no, excuse me, you don't have to complete those for the degree. So they come a little bit after. I got a little bit mixed up. You also have to complete several other things. So some schools will require you to complete 30 or 50 hours of personal supervision during the time that you're enrolled in their program. Associated with completion of the program is completion of the CCE, the clinical competency exam, which you take at the end of third year before you enter your predoctoral internship, and roughly 6 or 7 workshops in different areas like child abuse, in spouse and partner abuse, in substance abuse, in elderly abuse. You have to complete all of those prior to licensure, and many of those will have to be documented with the Board of Psychology as well. PsyD, so Doctor of Clinical Psychology or Doctor of Psychology in Clinical Psychology, takes roughly 4 to 5 years to complete, though that is not the only pathway to becoming a clinical psychologist. You can also become a clinical psychologist through a PhD in clinical psychology, so the Doctor of Philosophy in Clinical Psychology, or the EDD, the Doctor of Education. I don't know that much about the EDD, so I'm more familiar with PsyD and PhD. So many people will often query and they'll ask, what's the main difference between a PsyD and a PhD? They kind of sound the same. And usually the conventionally held wisdom is that a PsyD is more oriented towards clinical work, and a PhD is more oriented towards research, so learning how to conduct research, whereas many people say that PsyD is more oriented towards learning how to read and interpret research and then implement what you read, or the interventions that you read about in your own practice. I consider them, the same. So they're equivalent. I don't think that they're very different. The PhD is obviously the granddaddy degree. It's a much older degree than the PsyD. The PsyD is a newer degree and perhaps not as trusted by many people. In any case, some schools offer one, other schools offer the other, some schools offer both of them. PsyD, as I said, takes about 4 to 5 years to complete. PhD slightly longer, usually between 5 and 6 years. So it's a rigorous program. Any program in clinical psychology is bound to be very rigorous and challenging. One of those reasons is because you're not only completing coursework. So a requirement, usually after second year or at the beginning of second year and onwards, is to complete clinical training concurrent with your coursework. And that is frequently very challenging for a lot of students. So I did my first year placement, so my practicum placement at the university clinic at Sophia University, which was then called CCHW, I believe. They encourage you to complete your first year they would encourage you to complete your first year at the university clinic. My second year, my advanced practicum year, so my 500 hours, were at El Camino Hospital in the psychiatric inpatient unit. My predoctoral and postdoctoral studies were completed at the Community Institute for Psychotherapy in San Rafael. So that was a bit of a commute for me, and I struggled a little bit during that time because I didn't really want to move from Redwood City. So usually you are encouraged to rotate from site to site. So it's preferred if you seek out disparate clinical experiences with different clinical demographics or populations. So for instance, you might want to work with severely decompensated individuals 1 year. Another year you might want to work with families. Then another year you might want to do group. So depending on your own theoretical orientation, your own interests, and your own intentions to specialize in a specific area. Usually during your graduate training is when the first inklings of a specialization may manifest in your consciousness. So for me, when I was moving through graduate school, I knew that I was interested in schizophrenia, right? So my dissertation was in that specific area, and specifically, in the connection between schizophrenia and creative ideation. That was fueled in part by the fact that I have a cousin who suffers from the condition, and I was interested in schizophrenia as well, as a heterogeneous psychopathology. So schizophrenia was one of my interests. Then another one that I developed a little bit later, so in third year, was an acute interest in psychological and neuropsychological testing. And in my advanced practicum, I met my mentor, who was an assessment psychologist, and she introduced me to the wonderful world of testing patients. I tested a lot of patients that were inpatient and also outpatient. I started off with very brief assessments called MOCAs, the Montreal Cognitive Assessments. They're usually brief cognitive screens that are conducted when a psychiatrist or a doctor suspects an impairment. So it could be perhaps incipient dementia, so some kind of cognitive impairment or deficit. Sometimes they were conducted after electroconvulsive therapy to ascertain whether there were any residue memory impediments. So to see whether their attentional capacities were still there, or whether it had adversely impacted their working memory capacity or their executive functioning. So as you move, the point that I'm trying to get across is, as you move through graduate school, it's best that you rotate from site to site, because you'll contact different professionals with different expertise. So somebody might be an expert in testing, another person might be an expert in, family psychotherapy, another person in group psychotherapy, or whatever. Drug and alcohol, severe mental illness, existential issues, whatever. And your exposure, through the exposure to all of these different elements, you will start to gravitate towards one or many and start to form a professional identity. And that's the great thing about graduate school and about its protracted length. It's long enough in that you can start to identify professionally with one or more of these elements. My professional identity really developed through those years. Yeah. Okay, so for most graduate schools, or in most graduate schools, your clinical training will begin second year, not first. First year is predominantly completion of coursework, and towards the end of the first year, the clinical director at your school will furnish you with a specific username and password so that you can log into BAPEC, which is the Bay Area Practicum Informative Collaborative. And on the interface, there's an interface that you'll log into, and then you can plug in all your demographic information. You'll also be able to upload your CV, cover letters, letters of recommendation, which you will attain from professionals that you've worked with, or perhaps professors at your school. They usually write some very good recommendation letters. And on the BAPEC site will be listed innumerable sites that you can apply to. Under each site, there will usually be a description of the theoretical orientation, whether they do psychotherapy, whether they do assessment, the type of psychotherapy that they do, whether the position is part-time or full-time, or, you know, the requirement, the hourly requirements, and innumerable other things. I don't recall everything, but you'll get a sense of the site from the description that they furnish you with, and you'll be able to apply to your preferred sites, right? Depending on your likes and dislikes and the clinical demographic or population that you wish to work with. Most people will apply to at least 10, and it's highly recommended that you do so, which increases your chances of receiving a placement, right? Of matching with a specific site. I think many students fall into the pitfall of not applying to that many, and they miss out on a placement and then have to go onto clearinghouse. And that can be a very stressful and excruciating process. So you'll apply to the sites that you're interested in. I believe the deadline is sometime in February 15th of the following year. Then you'll be called in for your interviews, right? So if the actual site is interested in you, they will contact you and give you a specific time and date for an interview. You'll attend all your interviews in amongst completing all your other graduate school requirements. And then you'll await matching day, which I believe is in March or April. Don't quote me on that. I actually don't know. I don't recall from memory, but it's somewhere there, March, April for BAPEC. So on matching day, you will be able to log into BAPEC and you'll see whether you've matched with a specific site. The way that it works is that, you know, once you interview with them, you can log back into BAPEC and then rank them in order of preference, of your personal preference, and then they have the sites will have their own login, and they'll also complete the same process and rank their preferential students or their preferred students. And usually if you rank them highly and they rank you highly, that usually constitutes a match. So not always, it works according to this funky algorithm. So at the end of the process, so on matching day, you'll know whether you have a placement or not. A lot of students don't get placed. So as I said, that's immensely stressful for them. And then several days later, if you don't place, you can go to clearinghouse. So clearinghouse will furnish you with a list of sites that have available positions or positions that haven't been filled for whatever reason, and you'll be able to apply to these sites directly. And then the site will contact you if they wish to interview you. And then usually with clearinghouse, it's a lot more uncomplicated and simple, because you attend the interview and many times the clinical director or the panel of interviewers, if they're interested in you and they want to hire you, they'll tell you on the spot whether you're hired or not. So, and that's basically the process, and that process repeats year after year, unless you elect to stay at the same site, or they ask you to stay on for your advanced practicum year or your predoctoral internship, depending on which year you're at. As I said, most people will move from site to site because they want heterogeneity when it comes to their clinical experiences and the clinical populations that they've worked with. So BAPEC is for practicum and advanced practicum, and then for internship, for predoctoral internship, it is CAPEC, right, which mediates that. So California Psychology Internship Council, and as well as APEC. So the Association of Psychology Postdoctoral and Internship Centers. Yeah, so it goes up a notch for predoctoral internship because predoc is usually a full-time position. You need to complete 1,500 supervised clinical hours under the auspices of a licensed clinical psychologist. You will have a primary supervisor. In many cases and contexts, you may have secondary supervisors, particularly if you're working or you're doing outreach programs, maybe at a school or, at a family center or with a geriatric population. So you'll have different specialists that are supervising you for that population. So you may have one primary supervisor and two secondary supervisors when you're completing your predoctoral internship. I had assessment supervisors because I was immensely interested in assessment, psychological and neuropsychological assessment. So I had an assessment supervisor as well as a clinical supervisor. So that's the process. So recapping, we have 300 hours for practicum, 500 hours minimum for advanced practicum, 1,500 hours for predoc. And once you complete all of that, as well as a dissertation where you contribute a substantial body of knowledge to the field, as well as completing the CCE, which is the clinical competency exam, where you will be required to come up with a case formulation and present it in front of 2 or 3 of your instructors. Usually it's your clinical trainer or the clinical director at your school. And then the instructors will fire questions at you regarding your case formulation, why you chose one particular theoretical orientation, why you chose to view the case through one particular theoretical orientation and not another, why you elected certain interventions over others, and it goes on, and you have to be able to answer all of these questions competently so they can pass you. So you need to display competency in different areas which show that you're able to perform, competently in your internship. And then you have your PreDoc internship as well, which can be a fairly grueling year because you may be required to complete it in conjunction with your dissertation. Usually most programs will be structured so that you complete your dissertation before you go on to internship. Some of them, encompass a flexibility. So you'll be able to do half internship, half dissertation. But the ones that I know of usually require you to have at least passed your dissertation proposal before you start an internship. So then once you fulfill all of those requirements, you are able to graduate with your doctorate in clinical psychology, and then from that point on, you are known as Dr. So-and-so, PsyD or PhD. Yet, of course, despite the fact that you have a doctorate in the field, you are not yet a licensed clinician and practitioner in your state of choice. It's kind of counterintuitive almost that you have this doctor title, yet you're not actually licensed. So to become licensed, you need to fulfill additional criteria, right? There's additional things, hoops that you need to jump through. One of these is completing a 1,500 hour postdoctoral fellowship. So when I say 1,500 hour, that's usually the minimal requirement. It may be more, but 1,500 hours is what the Board of Psychology requires for both pre-doc and postdoc. 1 year, many specialized postdoctoral fellowships require 2 years. Those in neuropsychology, for instance, will require a 2-year postdoctoral commitment. It depends on the program. So those 3,000 hours together will qualify you for licensure, right? So that's the requirement that goes towards your licensure. The Board of Psychology, you won't be on their radar until you enter your predoctoral internship as an intern. Of course, there's various ways that you can complete an internship, either through a formal position, a formal internship, or you might be able to get a position as a registered psychological assistant under a supervisor who will be a licensed clinical psychologist. So for more information about that, you can visit the Board of Psychology, the California Board of Psychology. It's easy, just pull up Google and type in California Board of Psychology, and there's the website and all the information pertaining to licensure, exams, requirements is on there. Various avenues to licensure or pathways to licensure and so forth. So you'll be required to jump through a few more hoops for licensure, postdoctorally speaking. So once you complete the 1,500 hours, you also need to study for and pass 2 exams. So we're talking about licensure here in California, right? So the first exam is the exam for professional practice in psychology, also known as the EPPP. It is a grueling, gargantuan exam, the 4.5-hour beast, which many people spend many months, if not years, studying for. That's an exam that you can take immediately after you graduate. And many students elect to do so because the information is still fresh in their minds, right? In their consciousness. So a lot of times, the longer you wait, the more it tends to degrade, right? So it's gone. So then once you get back to studying, you feel like you're relearning, you're seeing material for the very first time. So the EPPP is the first giant hoop that you need to jump through. And then once you've passed that, you need to pass the CPLE, which is the California Law and Ethics exam, which is a much shorter exam, 2.5 hours in length, and much, much easier and simpler. The EPPP is very hard and grueling and excruciating for many students because many of the questions on the exam don't necessarily pertain to recalling bits of information wholesale, like rote memorization. They depend more and tax functions like critical thinking, where you're required to think critically about information and choose the most likely answer. A lot of the times you'll look at the 4 options and they all look the same, or they'll all be correct, but one is the most correct, right? So you have to use rational deductive, logical thinking to identify the correct answer. And many questions on the EPPP you might not necessarily find in the study materials, right? So the ATABs or the psych prep. So you'll study all this information in various subdisciplines of psychology, law and ethics, abnormal psychology, physiological psychology, which is neuroscience, cultural psychology, social psychology, research and psychological assessment. And then you'll go into the exam, and there's a specific question which is on a specific study that was conducted that wasn't in the study materials. And you're not particularly sure what to pick. You have to make an educated inference or guess. So that's what the exam is like. I remember when I took it, it was stifling for me because many of the questions I would look at and think, I don't recall this in the study material. It feels like this is the first time I'm seeing this. And then it's like there's these feelings of jamais vu, where you're like, oh, am I sitting for the right exam? So yeah, it can be a discombobulating experience, but it's much more difficult than the law and ethics exam. Once you pass the EPP, the law and ethics exam is a piece of cake to jump through. As I said, the EPP you can take as soon as you graduate, but the CPLE you can only take after you have completed and submitted all your supervised clinical experience or your training hours. So all your 3,000 hours are submitted to the Board of Psychology, and that will usually notify you that you've been approved to take the CPLE, and you won't be approved until you pass the EPP. So yeah, that's basically the process. So it's kind of like a description of the process of becoming a clinical psychologist. It's a huge relief once you do get there. It's a very, very long pilgrimage and path, but it's definitely well worth it if you're invested in helping others. Hope that has been of help to you. If you have any questions, please do not hesitate to contact me. I'm contactable via email, so you can write to me at paul@paulkaritzis.net, which is the email address associated with my website, or you can just email me. You can email through a personal email. So my personal email is tolakos, TOLAKOS, @gmail.com. Yep, so hope that has helped you. If you are contemplating or entertaining a career in clinical psychology. See you soon.